Hey Debbie, I am going to be doing the Lippincott cardiovascular questions right now. I guess let's go ahead and get started. Page 812, starting with question 700. A client with myocardial infarction is developing cardiogenic shock. Because of the risk of myocardial ischemia, what condition should the nurse carefully assess the client for? 2. Ventricular dysrhythmias. 702. The nurse is reviewing the electrocardiogram rhythm strip. The P waves and QRS complexes are regular. The PR interval is 0.16 second and QRS complexes measure 0.06 second. The overall rate is 64 beats per minute. What would be the correct interpretation based on these characteristics? 3. Normal sinus rhythm. 704. The nurse is watching the cardiac monitor and notices that the rhythm suddenly changes. There are no P waves, the QRS complexes are wide, and the ventricular rate is regular but more than 140 beats per minute. The nurse determines that the client is experiencing which dysrhythmia? 3. Ventricular tachycardia. 705. A client has frequent bursts of ventricular tachycardia on the cardiac monitor. What should the nurse be most concerned about with this dysrhythmia? 1. It can develop into VFib at any time. 707. A client has developed AFib with a ventricular rate of 150 beats per minute. The nurse should assess the client for which associated signs and symptoms? Hypotension and dizziness. 708. The nurse is watching the cardiac monitor and a client's rhythm suddenly changes. There are no P waves. Instead, there are fibrillatory waves before each QRS complex. How should the nurse correctly interpret the client's heart rhythm? AFib. 709. The nurse is assisting to defibrillate a client in ventricular fibrillation. After placing the paddles on the client's chest and before discharging them, which intervention should be done? 4. Confirm that the rhythm is actually VFib. 710. A client in VFib is about to be defibrillated. A nurse knows to convert the rhythm effectively. The monophasic defibrillator machine should be set at which energy level for the first delivery? The answer is 4, 360 joules. 711. The nurse would evaluate that defib of a client was most successful if which observation was made? 1. Arousable sinus rhythm, blood pressure 160/72. 712. The nurse is evaluating a client's response to cardioversion. Which observation would be of highest priority to the nurse? 2. Status of airway. 713. The nurse is caring for a client who has just had implantation of automatic internal cardioverter defibrillator. The nurse immediately would assess which item based on priority. 4. Activation status of the device, heart rate cutoff, and number of shocks it is programmed to deliver. Let's see. 716. The nurse is evaluating the condition of a client after pericardiocentesis performed to treat cardiac tamponade. Which observation would indicate that the procedure was unsuccessful? 4. Rising central venous pressure. 717. The nurse is caring for a client who had a resection of an abdominal aortic aneurysm yesterday. The client has an intravenous infusion at a rate of 150 mL per hour, unchanged for the last 10 hours. The client's urine output for the last 3 hours has been 90, 50, and 28 mL. 28 mL as the most recent. The client's blood urea nitrogen level is 35 milligrams per deciliter, and the serum creatinine level is 1.8 milligrams per deciliter. And the serum, okay, I already did that. That was all measured this morning. Which nursing action is the priority? 2, call the healthcare provider. 7:18. A client with angina complains that the anginal pain is prolonged and severe and occurs at the same time each day, most often at rest in the absence of precipitating factors. How would the nurse best describe this type of anginal pain? Variant angina. 7:19. The nurse notes that a client with sinus rhythm has a premature ventricular contraction that falls on the T wave of the preceding beat. The client's rhythm suddenly changes to one with no P waves, no definable QRS complexes, and coarse wavy lines of varying amplitude. How should the nurse correctly interpret this rhythm? 3, VFib. And that looks to be it for, this is actually Saunders. I did this to you last time. Anyway, remember that this is Saunders. I'm actually going to put a note on this for you so that it doesn't confuse you. Anyway, see you soon.